Hi, I'm Chris Duncan, licensed independent insurance broker, and this video is on Medicare Part A, and we'll jump right into it. Medicare calls Medicare Part A simply hospital insurance. And the most common question that I get from people is, Chris, how much does it cost? And Medicare Part A is $0 premium. It's what Medicare calls premium free. And the reason it's free for most people is they paid into Social Security for 40 quarters or more, or 10 years. And I'm also asked, Chris, well, if my spouse didn't work, will they also qualify for it? And absolutely, as long as one spouse worked and paid into Social Security for 40 quarters or 10 years or more, both people will go ahead and qualify for Medicare Part A. The next question I'm asked is, how do you enroll into Medicare Part A? And those that paid into Social Security for 40 quarters or more, or 10 years, or their spouse did for them, then they're going to automatically be enrolled into Medicare Part A, because it's premium free. So Medicare figures, since you don't have to pay for it, they're going to automatically enroll you into Medicare Part A. And that's going to happen whether you have any type of health insurance. You have group health insurance or individual health insurance. They're going to automatically enroll you into Medicare Part A. And it's going to become effective on the first of the month when you turn 65. So for example, if you're born anywhere between the second day of the month and the last day of the month, or the 31st of the month, then your Medicare is going to become effective the first day of the month. And if you happen to have been born on the first of the month, then your Medicare is going to go into effect a whole month early. I'll give another example of that. So for example, if you're born between September 2nd and September 30th, then your Medicare, when you turn 65, it's going to become effective on September 1st. And if you happen to be born on September 1st in this example, then your Medicare is going to go into effect a whole month early, and it's going to go into effect August 1st. You're going to want to be on the lookout for your Medicare card 3 months before your Medicare Part A goes into effect. So for example, if you were born in the middle of September and you know your Medicare is going to go into effect on September 1st, then you're going to want to start looking out for it in late May to early June, 3 months before the Part A effective date. And if you happen to have been born September 1st, like we talked about earlier, and your Medicare goes into effect August 1st, you're going to want to start looking for it, the end of April and the beginning of May in this case. And it's very important to be looking for it because it's extremely easy to throw away. We run into a lot of people that throw away their Medicare card because they're getting bombarded with a lot of mail from insurance companies trying to get them to sign up for their Medicare supplements and Medicare Advantage plans that they think is junk mail. So this is important. It comes in a plain white window envelope. And in the top left-hand corner in the return address section comes from the Department of Health and Human Services, and it has a logo on it. It's kind of a line logo. That's the way I describe it, of an eagle. And then also those lines form a couple of profiles of faces as well. So you're going to want to be on the lookout for that. Like I said, very easy to throw away. I talked to a woman a couple of weeks ago and told her, that your Medicare card was coming in the mail, and I described it to her, and she goes, Chris, I threw that out. I know exactly what you were talking about, and I threw that away. I said, don't worry about it. We contacted Social Security, got her a new card in the mail. Very easy to do. You can also do it online. Now, like I mentioned, Medicare Part A is called hospital insurance, and the easiest way to think about it is it covers you for anything that you go into a building for and you stay overnight. Now, that's certainly oversimplified, but if you want to quickly figure out what part of Medicare is going to cover you for a service, just think, am I going to be in a building overnight? Then more than likely it's going to be covered under Part A of Medicare. And some quick examples, and this list isn't all-inclusive. It's certainly a limited list, but it includes hospital stays, your skilled nursing facility stays, hospice care, and also home health care as well. And if something is covered under Part A, remember, you are responsible for some of the costs associated with the services. Medicare doesn't pay for all of the costs, as you well know. And Medicare has deductibles and co-insurance and co-pays, just like health insurance that you're probably used to having through your work or through insurance that you've purchased for yourself. Like I mentioned in the beginning of the video, I'm a licensed independent insurance broker, and I help people with their Medicare choices because Medicare, as you know, doesn't pay 100% of the bills. And the cost I'll talk about next can be paid for by what's called a Medicare supplement policy, also known as a Medigap plan. And they help in extremely lowering the exposure to the high unpredictable costs that Medicare doesn't pay for, and helping Medicare beneficiaries understand Medicare and what the cost to them can be is how I make my living. And I hope you allow me to help you choose your Medicare supplement plan. And we can provide you with a quote for anywhere here in the nation and your Medicare supplement free of charge. All of my services are absolutely free to use, whether you buy a Medicare supplement through us or not. First thing we're going to talk about is the Medicare Part A deductible. And the Medicare Part A deductible is $1,364. And that applies to each time that you enter the hospital per benefit period. Now, the per benefit period is a little bit confusing, so we'll talk a little bit more about it now. But the way Medicare defines a benefit period is it lasts, first off, 60 days. And every time that you're admitted into the hospital, you're responsible for a $1,364 deductible. But if you're admitted to the hospital during this 60-day benefit period a second time, then you are not responsible for the deductible of $1,364 again, unless you are admitted to the hospital for a different condition. So I'll give you an example here. Let's say that you had a heart attack on January 1st and you were admitted into the hospital, then you are responsible for the $1,364 deductible. And let's also say that you were discharged from the hospital and after 5 days, so on January 5th, and now you're at home and everything's going just fine. And say somewhere in the end of January, inside of this 60 days, you were readmitted because of the same condition. Not a second heart attack, but something related to the first heart attack. Then you would be inside of your 60-day benefit period, and you would not be charged the separate Part A deductible of $1,364. And that, like we said, that Part A benefit period lasts for 60 days, or basically till the end of February or a little bit after that in the beginning of March to satisfy the 60 days. Now let's say during that 60 days after January 1st, let's call it January 15th, you were admitted to the hospital because of a stroke. Now that's a separate condition. Now that is considered a new benefit period, and you will be charged again the $1,364, even though you had been admitted to the hospital prior to that on January 1st in our example for a heart attack. Again, because it's a different condition, you are going to be charged the Part A deductible again of $1,364. Now that Part A deductible, it covers you for being in the hospital for 60 days. Now, if you happen to be into the hospital over 60 days, then there is another subsequent amount of copayments that you're responsible for. So if you're into the hospital for more than 60 days, days 61 through 90, and there is a $341 copayment that you're responsible for each day that you're in the hospital for over 60 days. So in this example, if you were in the hospital for 90 days, you would be charged the $1,364 deductible, plus an additional 30 days past 60, so days 61 through 90, and then that copayment is $341, and if you went through that full 90 days like we talked about, you'd be responsible for $10,230. If you are in the hospital for more than 90 days, then the copayment for each day that you're in the hospital over 90 days is $682. But if you're in the hospital for more than 90 days, we get into something that's called lifetime reserve days. I'll explain them more here because they can be a little confusing. But you have a lifetime maximum of 60 lifetime reserve days. And I'll explain more here. Let's say that you're into the hospital for 100 days. And you're covered under Part A of Medicare for the first 90 days and then the subsequent copays as well. And you've been into the hospital for 100 days, then that is 10 days, obviously, over 90 days. Then you have used 10 of your lifetime 60 reserve days. So let's say a year later, you go into the hospital and you happen to have another 100-day stay, extremely rare, but this is the way the rule works. So you're in the hospital again for 100 days. The first 90, they're going to be covered by Part A, the deductible, and then also the copayments for days 61 through 90. And now you've gone into your lifetime reserve days again over 90. So for another 10 days, because this is a 100-day example, then you have 50 lifetime reserve days in this second hospital stay of the 60. And then you've gone ahead and, in this example, exhausted 10 more of those days. So if you have another subsequent hospital stay of more than 90 days, then you're going to have 40 left until you whittle that down to 0. Extremely rare, but it does happen from time to time, I'm sure, and it's something that you need to be aware of. We're finished talking about the Part A inpatient hospital costs. Next, we're going to talk about skilled nursing facility benefits. You're extremely more likely to use these skilled nursing facility benefits than you are of having an extended hospital stay. And they're pretty simple in the benefits and how you explain them. But first, the skilled nursing facility, generally speaking, we go into there when we're well enough to come out of the hospital, but we're not well enough to take care of ourselves at home on a 24-hour basis. We need help performing what's called our activities of daily living. That is dressing ourselves, feeding ourselves, bathing ourselves, taking our medication. Also need physical therapy, also occupational therapy as well. And it's important to note in the skilled nursing facility benefit, there is a maximum of 100 days of coverage per benefit period. So once you've exhausted the 100 days, if you're in the SNF, skilled nursing facility, for that long, then you have absolutely no coverage. But getting back to the 100 days, fortunately, the first 20 days in the skilled nursing facility, there's a $0 copayment to you. Those first 20 days are fully covered. But after that, there's certainly co-insurance, and those are for days 21 through 100. And each day that you're in the skilled nursing facility, more than 20 days, there is a $170.50 co-insurance that you're responsible for each day. And if you exhaust the benefit, the full 100 days, that's $13,640 that you would be responsible for. This covers the basics of Medicare Part A and a little more. I tried to present this in an easy to understand format. And if you'd like help shopping for your Medicare supplement plan, we could certainly help with that. In addition, if you have any other questions about Medicare, we're absolutely here to help you with that. Ask us any questions that you need. And as always, all of our services are absolutely free, whether you purchase a Medicare supplement policy through us or not. We're just here to help. And it's always important to remember that we're independent, which means we don't work for any of the insurance companies. We actually work for our clients. And because we're independent, we're able to provide you a quote from all of the different plans and all of the different companies to make sure that you're finding something that fits your needs the absolute best. So if you have any questions, again, my name is Chris Duncan. You can reach us at 800-910-3382, and we'll look forward to talking with you soon. Thanks again.